The meeting is underway between the health department and health officials in the province to find ways of how they will be able to deal with the outbreak should it come to the province of the Eastern Cape. Right now, Nompu, I'm joined by the Superintendent General of the Department of Health, Dr. Thobile Mbengashe. And as you can imagine, Nompu, it will be a very difficult task for the province of the Eastern Cape as it is deep rural areas where there are mostly clinics rather than hospitals. It boils down to logistics, HOD. How then do you navigate between clinics and hospitals, especially when we talk the deep rural areas where clinics don't have doctors?
Yeah, I think the most important thing is that we should stay with the science of how do you deal with epidemics like this one. I think we're also staying with the protocols that have been agreed both by WHO and the National Department of what we should be looking for. What is our priority now in terms of responding is to make sure that we consistently make sure that we do not develop an epidemic within our communities. So all our resources, we're trying to focus on that part. That means, one, to be able to identify correctly person who is actually suspected of having the virus. Two, our ability to follow that person with the tracing and making sure that we're able to find those individuals that were in contact. Three, that we isolate the person so that the person is not able to transmit to anyone. And then fourth one, obviously, the people that are ready for a quarantine. The second area is that we have a lot of experience of dealing with TB, even the MDR and XDR TB, which takes a very similar view about when you have identified an individual, then you must go back to the communities and actually find those individuals so that you can actually be able to make a diagnosis and make sure that they are not sick. The third area that we're trying to do is that we're wanting to make sure that the second phase where we're starting to see patients in our health facilities, we really want to be sure that the front line where people are actually getting in do understand what is it that they need to do. They are able to identify a case because there's going to be a lot of people with snotty nose, flus and aches and pains and all that. That had nothing to do with the coronavirus, the COVID-19. So we want our team to be very clear onto that. The second one, once an individual has been found, the team must protect themselves. We're really gearing it up to have the protective clothing and the procedures that they need to follow and make sure that the safety of blood testing is done. The third issue within that is that the central laboratory services is the one that do the test. And people are asking, where do we get the test kits? The issue on the test kit is not getting the test kit, is to get the equipment to take bloods and to take nasal swabs and the throat swab and being able to transport it properly to an ICD. So we're not going to have laboratories in the clinics and in the homes. It's really to do the test. Every doctor in our facilities has been trained. Most nurses, especially primary healthcare nurses, have been trained. They should be able to do that. We're going to be focusing on doing the build-up and actually the service and make sure that they are ready. The most important things for us is that we know in terms of the science, the majority of the patients that we're going to be dealing with, over 80% of those are going to have mild diseases. And the second one, that the second big group, about 10% or so, are going to have severe diseases. And there's going to be a small critical patients, which are really people with elderly, who have conditions that exist right now, and they're really going to suffer from a severe disease. What we are asking to do in terms of our services is that we want to stratify our services, have great capabilities of mild disease. Most of the mild disease that we're going to deal with are really going to be severe flu kind of type, and we want to make sure that we have a good facilities of really making sure that those who can be managed at home are able to be managed at home. And they still have a great capabilities of doing the follow-up, tracing, and making sure we're making those individuals understood. When people need to have hospitals services, we've looked at a number of facilities that we have. We have the high care facilities for highly infectious hemorrhagic fevers like the Ebola and others. Those facilities are very limited. We've got 2 or 3 rooms, and they are really high specialized. But we have the second level of facilities. We've developed very good facilities for MDR and XDR TBs. These are actually unique facilities with single persons, and they've got good extractors, and we can isolate quite a number of people. Most people with MDR and actually TB, after they've been on treatment for some time, you can move them up. They are not really infectious to the community if we reach that eventualities. And the other group that are not very sick, we're going to be promoting this idea that most of our district hospitals, we have a vacancy rates about bed utilization rate about 50%. We think we can actually take a lot of spaces in those district hospitals to be able to manage many of the patients that are in there. In the eventualities where there are huge numbers, which are really overwhelming, I think we can build what is called field hospitals. Take big tents like what we have done, cover them up and provide divisions onto that. We are not there yet, but these are really the different scenarios that we have. Our approach in really responding onto this, we really want to make sure that we understand the risks that we are faced with, we assess it properly, we provide a good mitigation strategy to respond to that, and then we make sure that we have got a team that is connected right across the province, both in terms of how we communicate, what needs to be done, following the protocols, and we actually do that. And then have a major people that goes out to the communities to make communities aware. What we are afraid of, and the thing that is really facing us, is false information, fake news, people talking about things that they don't know about. At the moment, there are no treatment in terms of medication for the patients that we're dealing with. We are looking at the support services, and our major concern is the elderly and those that actually have got existing conditions. We're going to prioritize those in terms of the risk profile of those individuals and provide them the best care that they have. My approach and the department's approach, we already have set up a team that is a combined team of a cross-functional team and expertise that are overlooking the process. They are developing the guidelines and the protocols. We're doing a lot of training, and we've got a big meeting today. I've called all my managers, clinical managers, so that we're all in one space. We hear what are the issues, we understand what are their concerns, and then we agree on the way how we're going to deal with the problem.
And speaking of the problem, HOD, and the front line where people come in your hospitals, your clinics, waiting areas, you're already dealing with an influx of people coming there for medical attention. How then do you make sure, because these are closed spaces where you have a number of people, and I think then you would need these protective clothing, your mask. Are you ready for that? How is that going to pan out?
I think this is an important question. People will remember one of the big things around the departments and really how we've been dealing is something called infection control, opening up windows and making sure that the windows are open, there's good ventilation. The second big one, which we now know, is what is called social distancing. We really believe that we shouldn't be keeping people in close proximities, because what is unique about the virus itself, it really needs close proximity with an individual to pass. And then obviously we would have to make sure now we're putting a lot of effort for hand washing, because that's another big thing. Because our hand washing is one of the major ways of people, as you recall, you don't get infection in your hands, but the big issues about hand washing is that we tend to touch our faces. The mucous areas like the mouth, the nose, and the eyes are really the entry point. So one of the things that's being said now, we are really encouraging people, avoid touching your mouth and your nose and your eyes with your hands. If you have to do that, make sure that you have washed your hands. Where we're going to do with this is that if we understand the identification of a potential case, the second big thing is to isolate those individuals, because the virus really spread from one person to another person. So the ability for us to put these facilities where doctors know that this is a patient that I'm unhappy with, there could be some problem is, the first thing is to isolate those patients.
And I know we've got a few seconds left, HOD.
Yes.
Well, we're talking about the issue of close proximity. How then do you open up spaces in the already crowded health facilities that you have, so that people can at least have some distance in between themselves?
This is an important thing. Actually, it's going to go beyond ourselves with the COVID-19, that essentially control of infections, especially flus and other viruses, is going to be something that we're going to live with now. We have to change our behavior and really understand that crowding patients in one space is not going to be a good idea. We have to transform our spaces now. We have to redesign where people are staying and actually create much bigger areas. It is possible without major cost to do that. And this is something that we're going to invest in to really make it so. The second one is that quite clearly our staff needs to really be able to understand how they protect themselves. Mask from staff is important. Gloves from staff is important. Protective clothing, especially plastic, are going to be important. We don't believe that many of the people who are moving around who are not infected should be wearing masks.
All right, HOD, I'm sure this is a conversation we're going to talk about the whole day as the virus keeps on continuing, but unfortunately because of time we are going to have to leave it there. Well,